Hello everyone, welcome to Notes Gurukul. In this video, we will study about implant overdenture. So, for those patients who require more retention and stability for an upper and lower denture, the all implant supported overdenture may be the answer. A removable implant overdenture is a prosthesis which is removable by the patient and is supported or retained by dental implants. So an overdenture is always removable. It is not fixed. The patient can remove his overdenture at night, and it is mainly used for cleaning purpose. Okay, so an overdenture can be removed by the patient, and it is supported or retained by the dental implants. The prosthesis has to be removed for the purpose of cleaning around the abutments. So here you can see these are the abutments. This is the male part and these are the female parts. So the prosthesis has to be removed for the purpose of cleaning around the abutments. So what is an overdenture? Overdenture is any removable prosthesis that covers and rests on one or more remaining natural teeth, the roots of natural teeth, and or dental implants. A dental prosthesis that covers and is partially supported by natural teeth, natural tooth, roots, and or dental implants. So this overdenture can be either tooth retained or it can be implant retained. So we can prepare overdenture either above the remaining natural tooth or natural tooth root also. On root stumps also we can prepare overdenture. Only if there is good periodontal health. Otherwise there is implant retained overdenture also, where we place dental implants onto the bone and above that we create an overdenture. So in this table you can see the types of overdenture. Overdenture can be of two types. Here we are mainly dealing with the implant supported overdenture. So the implant supported overdenture are of two types, that is tissue and implant supported and only implant supported. In mandible, we have to place minimum of 2 implants if we are planning for an overdenture which is both tissue and implant supported. Whereas in maxilla, we have to place a minimum of 4 implants. So more number of implants needs to be placed in maxilla as compared to mandible. And these 2 implants need to be placed between the 2 mental foramens. Okay, between the 2 mental foramens. Because the bone between the 2 mental foramen is stronger, it has more density, and the ridge height is also comparatively more. As we go more posteriorly away from the mental foramen, the ridge height gradually decreases. In case of tissue and implant supported overdenture, the masticatory force is transferred to the tissues, and it is indicated when the patient complains of denture movement. Suppose the patient already is wearing some kind of complete denture and complaining he's complaining of denture movement. So in such kind of cases you can give the patient an tissue implant supported overdenture. Now let us see what is a fully implant supported overdenture. So as the name suggests, there is no tissue support. The complete denture support is taken by the implant. In mandible, you have to place minimum 4 implants. So again, these 4 implants need to be placed between the mental foramen. Whereas in maxilla, you have to place again more number of implants, almost 4 to 6. That is, if you place 6 implants, it's quite good. And it transmits the masticatory forces to the implants. And the main indication is when the patient complains of pain while wearing his removable complete denture, pain on the ridge. In such cases, we will place multiple dental implants in the mandible between the 2 mental foramen, and in the maxilla 4 to 6 implants, and we will place an overdenture above it. Now let us see the tissue implant supported overdenture. So as I have said earlier, in the mandible a minimum of 2 and in the maxilla a minimum of 4 implants are indicated for this type of overdenture. The overdenture is mainly tissue bond type. The attachments give retention to the prosthesis. In eating, the ridge receives masticatory forces. The tissue supported implant overdenture is useful in the cases where the presenting problem is that of denture rocking or denture movement. Now here you can see the male and the female part. This is the male component, the abutment component. This is the male part, and these implant attachments, these are the female parts. This is the lower part of the underside of a lower full denture. Okay. Now let us see a fully implant supported overdenture. So in case of fully implant supported overdenture, we have to place minimum of 4 implants in mandible and 4 to 6 implants in maxilla. During mastication, the attachment assembly transfers all the masticatory forces to the supporting implants. And this type of implant overdenture is particularly appropriate for patients who present with considerable functional difficulty and pain while functioning on denture. So here you can see there is a bar attachment. Okay, so attachment is there. When we place multiple implants, we need to attach them with some kind of ball attachment or bar attachment. Okay,